Hello, my name's Carmel Smart and I'm a diabetes dietitian at the John Hunter Children's Hospital in Newcastle, where I've had the privilege of working with families of very young children with type 1 diabetes for the past 25 years. It is really difficult dealing with a toddler with type 1 diabetes, particularly around meal times because of the fear of hypoglycemia that's often associated with meals. We do encourage all of our families to routinely give insulin prior to meals, but some of the strategies that we use so that they don't get so scared that their toddler is going to go low is firstly encourage them to feed their child in a routine way over the day, such that they offer their child 3 main meals a day and 2 small snacks. And what that encourages the parent to do is to feel confident that the child will eat something at the meal time. The other thing we remind parents of is that insulin takes time to start acting. So although 5 to 10 minutes can seem very long when a child is refusing to eat, if the parent just stands back and the child is hungry, they'll usually start to eat something at that meal time. The other thing that we really encourage the parent to do is to not bolus or dose for too many carbohydrates at the meal. But individually, we advise them to have a maximum amount of carbohydrates that is age appropriate for the child, such that they know that the child will eat most of that carbohydrate dose. For example, in a 2-year-old, up to 30 grams of carbohydrate at mealtime might be very appropriate. The other thing that we often say to parents too is that if the child does undereat by about 5 to 7 grams of carbohydrate, that's okay and that they won't go low, and our studies have shown us that, until about 2 to 2.5 hours after the meal. And the other really important thing for young children with type 1 diabetes is that we know that they often don't eat enough vegetables, and that's common with all children all around the world, whether they have type 1 diabetes or not. So what's important there is to continue to offer small amounts of vegetables, to role model yourself, to sit with the child at the meal time, and also after about 20 to 30 minutes to remove the meal. So don't try to start feeding your child, let them finger feed, and then remove the meal if they don't finish. And don't be coerced into offering substitute foods like ice cream or biscuits because they don't finish the meal. But if you can, just calmly walk away, and I know it's hard, calmly walk away, and then re-offer them a snack about 2 hours later. So there's some of the things that families that I've worked with have taught me, and some of the studies have shown us works well with toddlers with type 1.